Everybody's seen a pulse ox before, and you may have one at home, but what I want to make sure is that the numbers on here are correct for you. Let me show you real quick. These pulse oxes are really cheap these days. You can buy them on Amazon or wherever it be, but you're only as good as the accuracy of this number. And so there are some that are FDA approved, there are some that are not, but there's one way as respiratory therapists that we make sure that this is a correct number for what you have. It can be thrown off. So you're gonna have two different numbers on this device. You're gonna have a heart rate, or it may say PR for pulse rate, and then you're gonna have your pulse oximetry, your SpO2, or your percentage of oxygen inside the blood, or bound to hemoglobin technically. So you're gonna have that percentage, and you're gonna have a heart rate. The heart rate is on there to let you know that it's an accurate reading. So you always wanna verify the heart rate on this with the manual heart rate of your patient. So if you have any question at all about the validity of this number, you need to count a heart rate. So let me show you real quick. I'll put this on my finger. I'm going to turn it on, and you're going to see the yellow lines across the bottom is actually called the pleth. 98% is the oxygen, and my current heart rate, or PR, is 97. So it's up a little bit because I'm just shooting this video. It's not usual for me. So I have that 98, 97. So to be able to know that 98 is a correct number for me, I need to feel my heart rate. So usually we'll put the pulse ox on one finger, and then we'll feel their heart rate from their other wrist. So how do you feel heart rate? You're gonna reach right here, right below the thumb. That's the radial artery, runs right through here. You have a radial artery and an ulnar artery. So the pulse is most easily felt right here at the base in this soft area, and you're gonna put some pressure there and you're gonna feel a pulse. Well, you need to have a clock with second hands or be able to count 15 seconds. So I'm gonna feel what this heart rate is, how many beats I feel over 15 seconds, multiply it times 4, and then that's gonna give my heart rate. So if I would check my heart rate, since it said 97, which is a little bit up, but if I felt it right here and it said 97, on the pulse oximeter, I should feel 24 to 25 beats in 15 seconds. That would tell me it's an accurate number. If it's reading anything that's off from the manual heart rate, do not trust the number. That's how you know, because there's a lot of things that can throw this device off. Fingernail polish, decreased perfusion at the finger, if it's just in the wrong angle or not quite put on the finger correctly, or you have some vasoconstriction going on. But one thing to verify is that the pulse rate on here is the same thing that you're feeling right here. And if it is the same, then I like to trust this number. That's how you use a pulse oximeter. I hope this helps.